All right, Commissioner Chung,
Here.
Commissioner Chow,
Present.
and Commissioner Guillermo.
Present.
And I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. And we can move on to item 2, which is the minutes of the September 6th Finance and Planning Committee meeting.
Thank you, Mark. And do we have a motion to accept the minutes?
Move approval.
I'll second.
And there's no one on the public comment line, so I can do a roll call vote. Commissioner Chung,
Yes.
Commissioner Chow,
Yes.
and Commissioner Guillermo.
Yes.
All right, thank you. The item passes, is approved. And we can move on to the monthly contracts report.
Good afternoon, commissioners. As Mark said, we'll try to move this. I'll try to be very brief in my introductory comments. Just one thing to announce: this month we sent the entire performance backup document as a reference for provider performance. Moving forward, as of next month, a brief statement will appear in the last line of each contract item in the Health Commission report to briefly state the results of performances detailed in the monitoring report, with the full performance backup document also provided as a backup document should you wish to refer to it. But as of today, as of today's meeting, it's the backup document. 15 items, so I'm going to keep the introductory comments very brief. We'll start with this month's Health Commission report, which has 4 items on it. The first is Toyon and Associates Incorporated. We have a new original agreement for to the Toyon and Associates agreement. Toyon and Associates Incorporated for a contract amount of $8,492,339. While this is a new contract, the current not to exceed contract amount of $10,051,966 is shown for comparison purposes, and this contract just ended as of 9/30/2022. The proposed change between the two total contract amounts is a decrease of $1,559,638 and is due primarily to the length in the contract term, which was reduced from 8.5 years to 5 years, and is offset in part by an increase in hourly billing rates and service hours. The department is requesting approval of a total contract amount of $8,492,339. The annual amounts for each of the 5 fiscal years in this contract are provided in the Health Commission report you have in front of you, for a total amount of $7,582,445, with a 12% contingency of $909,894. Due to timing constraints, this contract has been submitted to the Board of Supervisors and the Mayor for approval in September. The proposed amendment agreement is authorized under RFP 27-2021. Toyon will provide regulatory reporting and reimbursement revenue optimization services to the San Francisco Department of Public Health for the benefit of San Francisco General Hospital, Community Outpatient Primary Care, and Laguna Honda Hospital, as well as the health at home agencies. Services are not intended for any one target population. If commissioners have any questions, Matthew Sir, the reimbursement director for DPH, is here to respond, I believe.
Any questions, commissioners? Oh, I see Commissioner Chow's hand. And also then Commissioner Guillermo.
Yes, I had previously submitted a question, which I hoped you would have answered. Maybe you did. That there's a 26% difference, even though there's a reduction in the contract. So is it that you're anticipating an increase in volume? And is this really volume driven so that if, depending upon the amount that is collected or the amount that they work on in terms of how reimbursement is made?
So it's a mixture of both. So we contract with them to do fee for service work where we pay them an hourly rate, and we project that amount of work to increase and then there's also hourly rate increases for just CPI increases annually. And then you're right though that we do work with them where they do work on a contingent fee basis, and that work we are estimating, just because it's been a little bit the amount of appeal work that they do where we pay them a contingent fee based on successful outcomes has reduced over a number of years, and that's because some federal or CMS guidelines have sort of restricted what we would be able to appeal, and so some of that has reduced, and so it's a mixture of, again, the hourly rate and the workload increases for fee for service work, offset by a reduction or an expected reduction in the amount of contingent fee work that they will be doing.
Okay, no, that's fine. Thank you.
My question was just about the timing. You had said that this contract went to the mayor and the board of supervisors in September. So was it approved and we're doing a retro approval on for the commission, or I'm not quite sure what you were indicating there.
So I can address just the timing of where it is with the board and mayor's office approval, but I'd ask one of our contracts, or Dean, if you could answer the other half about what procedurally needs to be approved here. But so we went to the Budget and Finance Committee last week, and it was approved by the Budget and Finance Committee, and will go to the full board, I think, at their next meeting. I want to say is the 18th for full board approval. And then in terms of what's being asked of you here, I'm hoping that either Dean or one of our contracts folks can answer that question.
Commissioners, as you know, I'm new to this role. It's my understanding we definitely plan to and try to get these items to you before they go to the mayor and the board of supervisors. But I think that there was just a incompatibility in making that happen this last month. And due to the timing of one contract ending and the other one needing to go, items were rushed along as best as they could. I will try to get more information for you if that's helpful, but not entirely sure of how that happened with this particular contract. We do have a couple of items coming up on the agenda later today that are on here and will be going to the mayor and the board after the Health Commission reviews and approves it.
Thank you. I would just request some clarification for this and any future timing issues between our approval and that of the supervisors and the mayor's office. Thank you.
Absolutely. I'll research that and get that information to Mark after the meeting today. Any other questions?
Actually, I do now. So you mentioned that it went to the Finance and Budget Committee, and it will go to the full board for a vote in 2 weeks. So what informations did you provide them at the Finance and Budget Committee? Is that the same information that we're getting?
I believe so. Yes, largely it was sorry, I apologize. I don't know if you have a copy of the contract, but it was the copy of the contract, and the BLA had written up a report about their recommendation.
Okay, so you submitted that in the middle of September. Is that correct?
That's right. Yeah. Yeah.
Okay, so that would have missed the window for the Finance and Planning Committee, and this would be the first. Since then. So I think that, timing wise, like Commissioner Guillermo says, it would be better, if we actually are aware of these contracts before it went to supervisors, and instead of after the fact, it's just a little bit weird that we are still approving something that the board and the mayors already, had voted on.
Agreed. And I'll try to get more information to you. I have a feeling it was just the timing of it being too late for the September Health Commission meeting and just barely making it to the Board Budget and Finance Committee.
Yeah, and we can always have a special meeting just to approve like emergency contract. I think that that's something that we haven't really exercised as a committee, but it is like within our authority to do that. So, you know, and I think that right from the beginning of the COVID epidemic, I have repeated it, is that we want to make sure that we streamline things so that it makes your work easier, you know, like as a department as a whole. So yeah, so just want you to like keep that in mind for the future.
Thank you, Commissioner.
Okay, and I see a hand from someone else, but the commissioners are really the only people who ask questions in the meeting, just for the folks who are new, and we're really tight on time. This has already taken a lot, so we're going to move on to the next item. Please, Mr. Goodwin.
Thank you, Mr. Morowitz. Next, we have an amendment for a contract with Westside Community Mental Health Center to increase the total contract amount with contingency to $44,090,089, and to extend the contract end date from 12/31/23 to 6/30/28, or an increase of 4.5 additional years. The Health Commission previously approved this contract in November of 2018. The department is preparing to bring this contract to the Board of Supervisors for approval and is therefore seeking approval by the Health Commission for the proposed extension and increase in the not to exceed amount. The amendment is authorized under the solicitation RFP 8-2017 for the Westside Outpatient Clinic and Westside Crisis Clinic through June 30th, 2028. The Westside Assertive Community Treatment is part of an RFP under development and will end under this contract effective 6/30/23. The Child and Adolescent Outpatient Program will end under this contract effective June 30th, 2024. The department is requesting the approval of a total contract amount with contingency in the amount as stated of $44,090,089, which is an increase of $20,742,971 to an extent 4.5 years. The annual amount without contingency will increase by $208,944 due to the 4% increase in the CODB allocated in fiscal year 22-23. If the commissioners have any questions, Alexander Jackson, the Deputy Director of Adult and Other Adult Systems of Care of Behavioral and Health Services, is here to respond.
All right, commissioners. Commissioner Chow, I see your hand. And then let's start with Commissioner Gilliam on this time because we did the opposite before.
Yeah, I just wanted to note that in the report that's attached, that the West Side contract seemed to be underperforming their performance goals and in some instances not providing units of service. So I would request, given that this is a 10-year contract request for approval, that we that the committee gets more regular updates and reports on the performance or the performance issues in any case with Westside.
Thank you, Commissioner. Noted. And we will look that in.
Commissioner Gilliam. Oh,
Yes, my question was, as I wrote earlier, trying to understand, there is a 4% increase over your total contract, but in fact, you're dropping several programs. So in that case, it sounds like there's actually an increase to the remaining programs. And is there a way to understand that then as we're dropping programs, the other remaining programs have cost so X, but what you're showing is a total rise of only 4%. So what is the rise for the remainder when we drop the other programs?
That's a really good question. Commissioner, is Alex Jackson available? Has he joined us yet?
He's unable to. I can't get him in the meeting. I don't know why, but Alex, I've unmuted you. Can you answer that question?
Oh, can you hear me now?
Yes.
Okay, terrific. I don't know if you can see me or not, but
No, we're not able to see you because you're not in the room. You're on the line. All you are is a voice right now. But
got it.
will answer that question.
Well, I'm here to speak to the adult and older adult programs, which really haven't increased. That are actually the RFP for the West Side Act program was actually due to close at the end of the year, and so we actually want to take care of our clients and make sure there's proper transition, even though we're going into a new RFP to take care of those existing clients in the program. So I don't know if that accounts for that 4% that you may have mentioned, because we're extending the program to cover through the end of the fiscal year.
Yeah, I think the question would be helpful for you all to take some time and help explain to us, because by writing a 4% increase, it sounds like everything is only increasing 4%. But as several of the programs will actually, according to your write-up, be terminated in a year or 2 years, then the remaining programs actually have a different price. So I don't need that explanation today, but I do think that as we're thinking through this, that this is, I mean, we're not just looking at the total, but trying to understand if some of the other people suddenly get a 20% increase because we're dropping, two programs that were 50%, and yet we can write it's only a 4% increase. So those aren't actual numbers, but I think, see, what we're trying to get to is to really understand for the remaining programs, what is the real increase?
Okay, got it.
Okay, thank you.
Yeah, I just want to add one other point is that, like just because like programs are being closing out programs, it does not mean lapse of services, right? By any other means. Because like I think that some of these services are really crucial, especially, for those who are chronically mentally ill and have concurrent substance issues like the West Side Act. I just want to make sure that somewhere in these like footnotes that we can see, the change in programs does not translate to lapse of services, or at least, some type of explanations for that.
Yeah, definitely. What's nice about Westside, there is a continuum of care, so that those clients that are receiving ACT level services, intensive case management, they're able to step down to their outpatient program and continue to get services under the same roof. And not to mention all the clients that from all across our city that are able to come for crisis services and or urgent care services, that none of that will be impacted. So.
Okay. Thank you. Yeah. So if it's actually in the report, then like it would reduce a lot of like questions from our end, I think. But thank you for like mentioning that.
Okay, let's go on to the next item. And I'm just really worried that we're not going to get through all this. I'm not sure. I guess let's just proceed and we'll take it as we go, because time is already kind of going. So go ahead, Dean. The next one, please.
Great, thank you. Next, we have the approval of a contract amendment with Progress Foundation to increase the total contract amount with contingency to an amount of $221,847,999, and to extend the contract end date from 12/31/2023 to 12/31/2027 for an additional 4 years. Health Commission previously approved the subject contract in November 2018. The department is preparing to bring this to the Board of Supervisors for approval, and therefore seeking Health Commission approval for proposed extension and increase to the not to exceed amount. The amendment is authorized under solicitation RP 727 and RP 8/2017. The services are unchanged. The proposed amendment is authorized under RFQ 36/2017. Additional funding will continue to support prevention services for the CHEP program. The department is requesting a total amended contract amount with contingency, as I said, of $221,847,999, and an increase of $127,324,418. The annual amount with contingency will increase by $822,259 due to FFP Medi-Cal increase, and the Ashbury contract of $112,000, and other details that you have in front of you that I won't spend time reading off due to time constraints, but they're there in the report. If you have any other questions or thoughts, Young Jung Kim, Assistant Director of the Adult and Older Adult Systems of Care at BHS, is here to respond.
Commissioners, let's see, any questions? I see Commissioner Child's hand. And Commissioner Child, by the way, I did not receive any questions from you. So I know you're saying that you've sent them, but I didn't receive them. So the staff haven't received them either. So please ask them. It'll be the first time that we've heard this.
Okay, well, I think next time I will continue to look for your response that you got them, because we've been having some trouble with Yahoo, so I don't.
Sure. I just want to make sure that we were on the same page.
No, but then in that case, then I don't need a response today. I just want to point out that there is a difference in some of your costs, but I'm sure you've analyzed that before, and that this is a continuation of a contract. But I was trying to understand just the difference that social rehab has a 24-hour home life setting for 90 days in several of these institutions, houses like La Amistad, and then some are 1 year. It's fine. It was just a question as to why some were just specializing in 90 days. And do you then go, if you ran out of 90 days, to the next place? Because because of our timing, I'm not going to ask you to answer that, but it was just sort of an interest in understanding how the Progress Foundation was functioning. In all these large contracts, I'll just repeat it again, we would like to know where the stability of the organization is. And you don't have to really state it here. I would suggest that working with the department, we find out how we would get a better understanding of some of these big mega contractors in terms of their stability in face of the recent problem we've had with one of our large contractors. So otherwise, I mean, these are services that are really needed, so I don't have any objection to the services.
Thank you, Commissioner.
Okay, that's the only hand I see, Dean. So let's move on. Thank you.
Okay. The fourth and last item on this Health Commission report is for the approval of a contract amendment with Special Services for Groups, OTTP, to increase the total contract amount with contingency to an amount of $31,730,191, and to extend the contract end date from 12/31/23 to 12/31/27 for 4 additional years. The Health Commission previously approved this contract in February of 2019. The department is preparing to bring this contract to the Board of Supervisors for approval, and is therefore seeking Health Commission approval for this proposed extension and increase to the not to exceed amount. Amendment is authorized under solicitation RFP 1-2017 and RFP 23-2010. The total annual increase therein is an amount of $800,132 added in fiscal year 22-23 to expand their outpatient programming capacity due to the closure of Oaks Children's Center on July 31st, 2022. As the Health Commission was previously notified by memo from Hillary Coonan dated August 2nd, 2022, the department has worked closely with Oaks Children's Center to transfer all 62 youth to continue their outpatient services at Special Services for Group. We were requesting an approval of the total contract amount as stated, $31,730,191, an increase of $20,615,235, an extension of 4 years. Annual amount without contingency will increase by $940,840 for myriad issues detailed and explained in your Health Commissioner report that I'll not summarize here today because of the time constraints. If commissioners have any questions, Farah Armand, Director of the Children, Youth, and Family System of Care from Behavioral Health Services, is here to respond. Thank you, commissioners.
Any questions or comments, commissioners? I do not see a hand. And so not seeing a hand, if you all are completed with your questions and comments about the contract report, please consider a motion to approve.
Thank you, Mark. Do we have a motion?
So moved.
I'll second.
All right, and there's lots of people on the public comment line. I think most are here to support the staff, but just want to make sure that I'm doing my due diligence. Folks on the line, if you'd like to make comment on item 3, the contracts report, please press *3 now. *3. All right, I don't see any hands, so otherwise I'll do a roll call vote. Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes.
Okay,
We'll add this to our consent calendar. Thank you.
wonderful. So the next contract is a request for a new contract with Omnicell Incorporated.
Board request of approval of contract to buy pharmacy equipment, associated licenses, and support professional services. Total proposed contract amount is $9,669,563, which does include a 12% contingency for the term of October 1, 2022 through September 30th, 2031 for 9 years. David Smith, Chief Pharmacy Officer with DPH, and David Lipkowski, the Health System Executive with Omnicell, are here to provide more program details or answer any questions if you have them.
Hello, Commissioners. I'll try and be brief. I know the time is tight today. This is a contract we're requesting with Omnicell for just under $10 million. We brought this actually a similar contract last month with Omnicell and their company that provides really key automation devices such as dispensing cabinets, packagers, and carousels to improve our efficiency and safety and oversight for medication management, both at ZSFG and Laguna. This contract is actually about upgrading our current cabinets since they are end of life and will take between 12 and 16 months to eventually upgrade all of the cabinets. And we also are adding cabinets to our jail health services, so improving both efficiency and safety at our jail health services. These cabinets really try and maximize both patient care. They're a significant upgrade in the technology used to monitor all of our pharmaceutical usage, safety, and also mitigate diversion, especially of controlled substances. It's an upgrade that is just needed because the cabinets are quite frankly quite old. And we're purchasing these cabinets outright, and then ongoing costs are going to be associated with maintenance across the board and license fees. And so with that, I will be brief and see if there are any questions we can answer.
Commissioners, before we go to you all, folks in line, if you'd like to make comment on item 4, please press *3 now. *3 now. All right, I see no hands from the public. Commissioners, any questions or comments from you? Okay, so if no questions or comments, please.
I actually have one. So yeah, that's why it looks familiar. Last time we were buying out like existing equipment, and this time this is for upgrading.
That's correct. Yep.
Like why do we have to like separate the two contracts? Like, yeah, one in September and then another one in October. So I think that, if they can be together, like it tells a full story rather than having to continue the narrative in the following month.
I completely agree with you, Commissioner Chung. Completely agree.
Thank you.
All right, thank you.
We need an individual vote on this.
Yes.
Correct?
Yes, so we need motions.
I'll move approval.
I would second.
All right, I'll do a roll call vote. Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes.
All right,
We'll add this to the consent calendar. Thank you.
we have a group of contracts coming up next. I believe Nicole Trainer will be presenting. I think it's you, Nicole, who presenting the RFP, and then the contracts that go with that. And once you talk, I can go through and we can do votes. Each contract has to be voted on separately, but they can be discussed together as an intro.
Yes, Mark, that is correct. I could begin with an overview. Good afternoon, Health Commissioners. Dean, are you okay with me just jumping in for the seven contracts?
Absolutely.
All right, great. Thank you so much. So Health Commissioners, today, the CHEP System of Care is seeking approval for all 7 new health access point contracts that were subject to RFP 4 2019 solicitation. As you may recall, back in September of 2021, and also I believe around June of 2022, Chet provided an overview and update to the Health Commission on the purpose of the solicitation and also who was, what agency was selected. The finalization of the solicitation process was significantly delayed by COVID, as you all know, since 2018 when the RFP was originally submitted. And just for memory and reiteration, each of the 7 new contracts that were funded, the first agency was Instituto Familia de la Raza for the Latinx Health Access Point, Lavender Youth Recreation and Information Center. The focus is on young adult health access point. San Francisco AIDS Foundation focuses on gay MSM health access point. San Francisco Community Health Center, also doing business as API Wellness, focuses on trans women health access point. Ward 86, UCSF, people who inject drugs, health access point. Alliance Health Project, also UCSF, populations focused on Asian Pacific Islander Health Access Point, and Rafiki Coalition is a unique health access point in that it focuses on capacity building specifically for the Black African American population. These agencies were all selected again through the RFP 2019 process. Each contract is 3.5 years and will begin on January 1st of 2023, again with the duration of 3.5 years through January 30th of 2026. This again is a brand new model, so we haven't maximized the length of the length allowed by the RFP in the event we need to revisit the model in any way. So if the total amount of funding exceeds 10 million in the subject budget, the contract will also receive approval by the Board of Supervisors. And right now, I believe there's one agency that will be also presenting to the Board of Supervisors. The purpose, again, of each of the proposed contracts, in short, is to enable DPH to implement a new model called the Health Access Point, with each half serving the specific populations that I just mentioned, with an equity focus, stigma-free, and low barrier access to person-centered standard of care services, regardless of an individual's HIV status, their Hep C status, or their STI status. These health access point and services will also contribute to the citywide Getting to Zero initiatives that focus on 0 new HIV infections, 0 HIV-related deaths, 0 stigma and discrimination. Also, we've included the elimination of Hep C and the reversal of increasing STI rates, and of course, the elimination of sexual health and drug user health, racial health disparities, and accessing services in targeted communities in San Francisco. If you have any additional specific questions that are about any of the 7 contracts, I'm here and happy to answer any questions. I also have representatives from each of the agencies if you have more programmatic specific questions if desired. Thank you.
Commissioners, thank you so much, Nicole. We are looking at items 5 through 11 in terms of what Ms. Trainer just talked about. So if you have any questions on those or any comments, please let us know.
Did you ask for public comment already?
No, I'm actually going to go to you all first, and then I'm going to go through each item before you all vote on them to ask for public comment, because this is a kind of a convoluted way we're doing this with the discussion.
Well,
So
actually,
I
I
had a
don't think this is the first time we've done it that way. We've done it similar before. So yeah.
Yes. Thank you, Commissioner Chung. Commissioner Chow has his hand up.
Yeah, I'm sorry that you didn't get my note that I thought I had sent on Sunday, but like I said, we'll double check with Mark in the future to make sure that you get these, because I wrote 2 actually long pieces. And they aren't related to the intent nor to the contracts, so I'm not here to be negative on the contracts, but merely to point out some issues. I think one technically, our new contracts used to carry and does on the Omnicell, I believe, an annual cost for the contract. None of these carried that. And so I don't know why the format of the summary of the contract changed, because we had asked for that to be put in many years ago so that we wouldn't have to sit there and divide and calculate what the cost was. And we're assuming that you all have that actually. The second issue is that contracts for UCSF are actually mislabeled. It says the University of San Francisco, but it's not the University of San Francisco. Obviously, it's UCSF. And so I don't know if technically that makes a difference or not, but it should be corrected before it moves on to wherever it goes. The other thing is, in fact, is the contractor really UCSF? Because the listing of the foundation, the listing of the board of directors is not the board of directors of the regents of the university, but in fact appears to be that of the UCSF Foundation. So the question is, who is actually that contract related to? And if it's related to the regents, then you have in fact instead a listing of the board of directors and the executive director of the foundation. Several of them had included under the board of directors merely 2 or 3 members, and maybe that's all there are, or the officers. But it also was supposed to include the executive director, and the executive director's name is not included in any of those. It is useful for us to know who the executive director is also, because often they are people that we are very comfortable with and feel that that adds credibility to the contract. I think the one that I have the most concern about, and only because I think you mentioned the difference, was that the Rafiki Coalition was doing capacity building, but the way it was presented, it sounded like we're presenting this while everybody else had details of services. Rafiki didn't have any, and there wasn't an explanation. So maybe you would provide us an explanation of what that is going to be. Also, I believe that is there's a contract that reads that we haven't done any business with these people because you comment that, not you personally, and that is with the a later contract that we can talk about later. But anyway, I think the substantive issue is, what is the Rafiki contract? Why does it not show units of service? You mentioned that it was capacity building. So how does this contract work?
Right, great. Those are some really great questions. I'll focus on the Rafiki capacity building model and why that was developed. So just some brief context behind that. Prior to developing this new health access point model, CHEP did about 2 years of extensive community and stakeholder meetings and ethnography around what was needed from the community. One of the things that came up specifically around the Black African American community, as you know, they continue to bear a disproportionate burden of disease across the healthcare continuum, especially when it comes to sexual health and drug user health. From the stakeholders' lens, it was needed that Black organizations within San Francisco tend to not be able to apply or don't have the capacity to integrate some of the sexual and drug user health services that CHEP is requesting. And so in efforts for us to support the community and continue to show up for the community, ensure that there's services that are reaching this community, it was essential that the agency who applied for this particular category implement capacity building activities so that they had the resources to increase staffing, the resources. An example model of an agency that we would like to see in the Bayview Hunters Point is a model designed like the San Francisco AIDS Foundation, where they have a clinical on-site clinicians. They're able to implement all of the standard of care services, not only within their organization, but also with subcontractors. We want that same level of capacity to be implemented in Bayview Hunters Point neighborhood to serve the Black African American communities there. And so that requires a level of capacity building. And so what we built into this model is 18 months of capacity building. That will continue, that's ongoing. If you noticed in the Health Commission memo, the standard of care of services that are required will be provided in kind by the subcontractors. that Rafiki has contracted with. But these 18 months allows Rafiki Coalition to build their capacity, not only on the operational side, but the infrastructure, building space for them to efficiently implement the required service of this RFP. That's why it's so different. And it comes from the community voice and what they want. Yes.
So how large is the coalition? How many organizations are you really looking at or at targeting to build out a Centers for AIDS program?
Would you mean how with where there's only one agency funded? Rafiki Coalition is one agency. Currently, the subcontractors will be built out in the planning phase of their the capacity building and planning phase of their program. But right now, they're also subcontracted with the foundation and Third Street Health Clinic.
So are we saying that it's going to cost 2.4 million per year over 4 years in order to develop a foundation or a program?
No, so the HAP is funded 2.4 million a year. It's not that they will be doing only capacity building work for 3.5 years. We've slated out the first 6 months for program planning and designing, and then also the first year of the contract to do an internal assessment of capacity building assessment and the needs. So the system of care has allowed 18 months for the implementation of capacity building activities, with the expectation is that the second year of the contract, the standard of care services will be rolled out and implemented either at the lead agency or through the subcontractors.
Oh, okay, so it
Yes.
means that in the second or third year, there will be services, and this will be, what is the 2.4? And it isn't that 2.4 is being spent every year to plan.
No. The planning allocation is around 18 months. With the expectation with any agency, there's always ongoing capacity building because this is a new model. So even all of the HAPs will have some level of capacity building.
Okay, and just technically, can you answer the question about the UCSF contract? Is it with the regents actually, and we put the wrong organizations down?
Yes, that is correct. It is with the regents. And I will check in with both Ward 86 and AHP to ensure that we have the right foundation, the board members listed. But thank you for pointing that. I just added that to my notes. But you are correct. The contract name on our certified documents, on our older contracts, is with the regents. That is correct.
Okay, and normally then with UC, we have not gotten the individual, supporting foundations, but the regents, because that's the organization that we're really contracting with. So
Okay.
thank you for clarifying that.
Okay. I will make sure that's updated. Thank you.
Any other questions or comments, commissioners?
I have a question.
Questions. I have a question. No.
Oh, go ahead, Commissioner Guillermo.
So first of all, I just want to state that I'm happy that this new model is being implemented, and I fully understand the need for capacity building, and actually appreciate that is something that the department has considered, particularly if it was voiced by the community in terms of that's what's required. So I'm glad to hear that, but I do worry about what restrictions might be put on the capacity building needs, especially since this is sort of new. And so I would hope then that if we are allowing for the 18 months of capacity building, that we really do it in a way that is both innovative and responsive to the community,
Absolutely.
as opposed to per some sort of standard of some other sort of model that has not yet been developed or is not responsive to this community. And that would go
Absolutely.
for any of the other contracts that have some degree of capacity building. I think that this is so important for organizations that are providing these kinds of services, particularly for a new model, to have the time and the latitude to do what is appropriate to build a long-lasting model that can be evaluated. And speaking of evaluation, I'm not sure, it says in each of the contracts that they will be evaluated or monitored by the department as required. And I would just like for the committee and maybe the commission as a whole to really understand what does that mean in terms of the monitoring and evaluation. Again, this is a new model, so I'm assuming that there is a sort of strategic understanding of how this is supposed to work, and not necessarily outcomes driven, but certainly on a process basis, that we understand what we are going to be looking for as we monitor these contracts. And so I look forward to hearing more, and about sort of the sort of on a qualitative basis as well, and not just, we don't just need to look at the numbers. We do really need to understand what the model itself is producing. So just wanted to make sure that that was understood.
Yes. Thank you so much. It is definitely understood, and CHEP is working internally on program evaluation model that the HAPs can feed into their data. We're also building out a referral network system that will also be tracking linkages and patient outcome as they access the HAP networks across all 7 HAPs. So I'm
Yeah,
looking
and
forward
yeah,
to that.
just one other comment, because the difference in implementation of the model from a UC versus a community-based organization, there's really going to be differences, particularly given the
Absolutely.
capacity and the infrastructure. So I'd really like to have some of that sort of nuance or some of that information in terms of, how is the model working from a large, university system to a nonprofit organization. What are the distinctions and what are the issues that are surfacing from that?
So what I'm hearing
Well, thank you.
Commissioner Guillermo is also saying is that, like this is a chance to develop some best practices or case studies to see what's actually replicable and what needs to start from scratch, especially like the investment that we're doing with Rafiki coalitions. I think that this is great. Like Commissioner Guillermo said, I think that this is really a good way to look at like health access, like moving forward. And can we actually get this presented at the Communications and Popular Health Committee?
Commissioner, do you mean the contracts or the concept, or do you mean
The
like?
concept.
Yes.
Yeah, not the contract.
Yes, I think it was, and maybe you all, I'll look back and send you that presentation, and then maybe you all can get an update in 3 to 6 months so that you can see how the model's being implemented. Sounds great.
Yeah, so we get things pretty fragmented, so sometimes it might take more than just a piece of paper to remind us like what is connected to what. But
Right.
thank you.
No problem.
So,
Yeah, I had a follow-up question, which is, and Mark, the director's report was talking about this new overdose program. Is this part of that overdose program, or this is separate as another initiative for substance abuse and drug use
my,
or mental health?
I
Again.
speak to the department, but my understanding is the overdose prevention model is a whole new initiative that's not related to HAP. I don't know if the HAPs are involved in it. Nicole, do you know if the HAPs are? Yeah, I think they're separate services.
They're separate services. However, the HAPs will be connecting to different services across the city to serve their populations. But I do want to point out in the standard of care that's required for each of the HAPs, they're required to implement mental health services, primary care, substance use services, also overdose prevention, syringe access, and disposal services as well. And that includes harm reduction, naloxone as needed, fentanyl testing strips, and so forth.
So we're really going to have 2 programs going that also
It's
take care of the same population?
Well, it's not necessarily 2 programs. So the Health Access Point serves as wraparound services, meaning that if I'm a client, I should be able to walk in the doors and receive these continuum of standard of care. What the community voiced to us is that they didn't want to walk into an organization and all they provided was HIV testing. They wanted to go in, and if that organization, you may not provide primary care on site, but that agency is connected and networked to a primary care services. So the health access points they serve as a network. So these health access points are not going to be designed for them to operate in their silos. So I may be an individual, but I also identify as a Black woman. I identify as a woman who also needs mental health services, or maybe I'm also injecting drugs. So I can go to Rafiki for health services. I can also go to Ward 86 because they specialize in people who inject drugs. But I should also be able to walk through those doors to get basic needs. If I need food, if I need employment services, education, housing, the individuals in that health access point should be able to provide those linkage to those services, and not just a handoff, but following up and being able to identify the outcome of those services that they connected that individual with.
Oh, okay, no, thank
Yes.
you very much.
You're welcome.
And thank you again, Nicole, for all that. And Commissioner Chow, I will get more clarification too on for you offline about the overdose prevention plan and how it might at some point interact with the apps. But thank you. Any
Thanks.
other questions or comments from you, commissioners? All right. So, oh, I'm sorry.
It makes me feel old that, like we've come a long way since, like 20 years ago, we adopted the model of Center of Excellence, for HIV services.
Yeah.
So kudos to you all.
Yeah, thank you. And this model, Health Access Point, Commissioner Chung, was modeled off of the Center of Excellence best practices.
Well, I feel old. I was sent to help approve.
So, commissioners, what we're going to do, and the folks on the line too, is we'll go item by item, and you all will vote contract by contract because the items are listed separately. So I apologize for the arduous process. I'll do it as quickly as possible. We'll start with item 5, which is the contract request with Asian Pacific Islander Wellness Center. Any folks on the line want to make public comment on this item? Again, this is item 5. Press *3. I see no hands. Commissioners, please consider a motion to approve.
I move approval.
Second,
All right, I'll do a roll call vote. Commissioner Chow?
Did you say Chow or Chung?
Chow.
yes.
Commissioner Guillermo?
Yes.
And Commissioner Chung?
Yes.
Great. Item 6, a new contract request with Rafiki Coalition for Health and Wellness. Folks on the line, would you like to make comment on this item? Please press *3 now. All right, I see no hands. Commissioners, again, please consider a motion for item 6.
So moved.
Second.
All right, go back to both of you. Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes.
All right, the item passes. Thank you. Item 7, new contract request with Instituto Familiar de la Raza, Incorporated. Folks on the line, if you'd like to make comment on this item, press *3. I see no hands. Commissioners, please consider a vote. Item 7.
I move the acceptance.
I second.
I'll go back to you, Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes.
Thank you. Item passes. Item 8, new contract request with the San Francisco AIDS Foundation. Folks on the line, if you'd like to make comment, please press *3. I see no hands. Commissioners, please consider a vote. Item 8.
I'll move approval.
I would second that.
All right, Commissioner Chow,
Yes.
Commissioner Chung,
Yes.
I'm sorry, and Commissioner Guillermo.
Yes.
I did that out of order. Okay, great. Item 9, new contract request with Lavender Youth Recreation and Information Center. Folks on the line, please press *3 if you'd like to make a comment. All right, commissioners, no public comment. Please consider a vote on item 9.
Move approval.
Second.
Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
And folks on the line, just for you to know, we have to do all this because of the Brown Act and the Sunshine Ordinance. It's very specific at how public meetings have to be run in the city. That's why we're doing this. Item 10, request for approval of a new contract with the University of California, San Francisco, UCSF, Ward 86. If you'd like to make a comment on the line, please press *3. I see no hands. Commissioners, please consider a vote. Item 10.
I'll move.
I would second.
All right, Commissioner Guillermo,
Yes.
Commissioner Chow,
Yes.
and Commissioner Chung.
Yes.
All right, the item passes. Thank you. Item 11, request for approval of a new contract with the University of California, San Francisco, UCSF Alliance Health Project. Folks in line, if you'd like to make comment, please press *3. I see no hands. Commissioners, please consider a vote for item 11.
So moved.
Second.
Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
Thank you so much. That was just quick as we could do
Mark,
it.
did we do number 5?
Yes,
Okay,
the
sorry.
first one I did.
Okay.
Thank you for caring and going back. Now the next group of contracts are also there's 3 contracts under an RFP, and I have a few people who are presenting. I think Patricia Irwin and Vincent Fuqua, and Jessica. Oh, I believe Jessica Brown's out. So are you two, Vincent and Patricia, are y'all on to present?
Yes, Mark, I am more to present for us.
Thank you.
You're welcome. Hello, Commissioners. So I'm Vincent Fuqua. I'm actually part of the Office of Health Equity and the Community Health Equity Promotion Branch. And today we're actually seeking approval for all three new contracts that were subject to RFP for 2022. The 3 contractors are Booker T. Washington, Bayview YMCA, and Rafiki Coalition. All 3 of these contractors is getting $1,477,643, which includes the 12% contingency annually for 4 years, which is a total of $5,910,572. In the memo that was sent out, 2 of the contractors have the 4 years total on it, and one of the contractors has an annual total on it. But note that all 3 contractors are for 4 years. And they're funded through the Community Health Equity Promotion Branch and the Mental Health Service Act. So they're getting funded by 2 different sources regarding that aspect of it. Our target population is all Black African Americans that lives here in San Francisco, and the whole idea is to reduce the health disparities among African Americans here in the city, because as we are aware, there's a high disparities among Black African Americans in the city, and the idea is to come up with services to reduce those disparities. And so the agency will be focusing on outreach and engagement, screening and assessment, wellness promotion services, service linkages, individual and group therapy, and services. So looking at mental health overall. So if you have any specific questions, feel free to ask. And also all 3 contractors are also on a call to answer any programmatic questions that you may have. Thank you, Commissioners. Thank you, Mark.
You, Vincent. Any questions or comments, Commissioners?
Yes.
Commissioner Chung.
Well, thank you for the presentation. So this is more about my own curiosity, because like their stated contract FTEs are all different. And for YMCA especially, like it mentions staff hours, but how many staff are they hiring for that?
Thank you.
That's my curious question.
So the question is how many staff they're hiring for the program itself?
Yes.
Yes. I can turn that over to one of the program person who's actually on the call, Gigi from the Bayview Y.
Hello, can you hear me?
Yes.
Hi, good afternoon, everyone. So again, this is funded by 2 sources. And so are you requesting for the total staff, or staff from CHEP and then staff from each funding source, or?
I'm just, yeah, I'm a little bit confused because, like 2 of the contracts actually had mentioned how many FTE going to be working on the contract for the contract, but Y has no indications at all. So does that mean that it's all part-time staff, or is it that they have not decided how many staff would that be?
No. We do have this. We do have the capacity for the staff. We actually have staff present. So we have 2 exempt staff and 4 full-time staff, and the rest of the staff is part-time, which is a total of 10 staff part-time.
Okay. So that explains all the like staff hours.
Oh, yes.
Okay. All right. Okay. That's all.
Okay.
You're welcome.
Thank you, Gigi.
Thank
Thank you,
you.
Commissioner Chung.
Commissioner Chow.
Yes, going back to the contracts, they are retro, beginning July 1. I think you mentioned that they were all 4 years, but I didn't quite understand that because Booker T. Washington seems to say it is 1 year. And under the YMCA, it also doesn't say the number of clients that are being managed or being seen. Is there any way to understand that?
Yes, yes, yeah. Thank you, Commissioner. Yes, yes. So they are all they are all for all three are for 4 years. What happened when it was submitted? The analyst for the Booker T. Washington just put 1 year instead of 4 year annually. So they didn't do the whole 4. They only did it annually when they submitted to y'all. But everyone is actually for 4 years.
Well, how do we vote on everyone for 4 years when we only have data for 1 year? I mean, this says that it's voted for 1 year. That's why I'm not sure how we're intending then to say that we're really voting 4 years.
Yeah.
I'm sorry. Go ahead, Commissioner.
I think that there are two options. Like we can, like since we're going to vote on them individually, we can vote on this as a 1 year contract for Booker T. Washington's, and then come back later, like for to add it back to the contract report, that to state that it's actually a 4 year contract. That would be my suggestion. Or if you want to like actually fix that and come back with this contract next time, we can do that too. Since it's retroactive, it doesn't really.
Right, and just thank you, Commissioner. Just to clarify, Vincent and other folks on the line, because there's the sunshine rule where everything that's going to be approved has to be noticed 72 hours ahead of time. This is not possible to change something like the number of years. If there was one mistake of a number, that's one thing, but changing the number of years and all the money that goes into it's not possible. That's not possible for the commissioners to approve. So Commissioner Chung is trying to do her best to make sure that this goes through and the services start, and then you all can come back and do a modification to add.
That makes sense. That makes sense to me, and I'm good with that. Thank you.
I'm making a note of that as well, and we'll plan to bring this back. Thank you, commissioners.
Sorry, just a clarification. So we're going to attempt to vote on this particular contract for 1 year, but with that budget amount, and then go back and make the correction at the next meeting.
And vote
That's
on
my
the
understanding.
correction.
Yeah. From the recommendation of Commissioner Chung.
Well, so thank you, Commissioner Guillermo. So I need to ask the clarification as the person who supports the commission. So is the amount right and just the years are wrong, or is every?
That is correct. You're correct. It's 1,477,643. That's the annual budget. That's what they get. But the total amount for 4 years is the 5.9. It's a 5 million one.
Okay.
So the amount that is in there is correct. The
For
1.4 that is the correct amount for the annual year. That is correct.
Okay. All right, Commissioner Guillermo, does that?
Yeah, that makes it clear. Thanks.
Okay. Commissioner Chow, I see your hand
Commissioner.
or do you have another comment or question?
Well, no, it's just to again point out to whoever is doing the analysis about the number of years DPH does business with Rafiki. That's not meant to be related to this contract, but how many years as a department we've been working with them. And so perhaps somebody misunderstood the question. Because otherwise, everyone for new contracts could just have 0, and we wouldn't have any purpose of asking the question. That's all.
Thank you. And sir, just so for my note, that's on this contract. That's on the one on item.
It's on the Rafiki for this last one, right? That you have in the batch.
Thank you. I just want to know when I look back and talk to Dean about
Right.
it. Okay.
Yeah.
Thank you. Okay. So it seems like we're ready to go to the public and to vote. Unless there's other comments, let me get my agenda real quickly. Okay. Thank you again, Vincent. We can move on to item 12, which is a request for approval of a new contract with the YMCA. Folks on the line, if you'd like to make comment on this item, which is item 12, please press *3. All right, no hands, commissioners. Please consider a motion to approve.
So moved.
Second.
I'll do a roll call vote. Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
Commissioner Chung.
Yes.
All right, item 13, folks in line, if you'd like to make comment on the Booker T. Washington Community Service Center new contract request, please press *3. I don't see any hands, Commissioner, so please consider, and remember, this is a consideration for approval of the one-year contract.
I would move that, and Mark, actually, all three contracts have that same problem of the DPH history.
Okay, thank you. And could we get a second?
Second.
Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
Okay, thank you. And then one more. Item 14, folks online, if you'd like to make comment on the new Rafiki Coalition for Health and Wellness contract, item 14, please press *3. Okay, no comments, Commissioner, so please consider a motion to approve.
So moved.
Second.
All right, Commissioner Chow,
Yes.
Commissioner Guillermo,
Yes.
and Commissioner Chung.
Yes.
All right, this is approved. And when I say approved, by the way, this is all going to the consent calendar where the Health Commission will do the final approval at the next meeting. Thank you again, Vincent, and all the folks who are on the line. And so, commissioners, we actually have time to, y'all been very efficient and effective, so we can move on to the presentation. Item 15, the sugary drinks distributor tax policy systems change, contracts update. And commissioners, this was a response to your request to hear how these contracts are doing after you approved a similar batch like you're doing today. I think it was maybe 6 or 7 months ago. Give me 1 second to pull up the presentation. All right, does that look okay?
Great.
Okay, great. Go ahead, Christina.
Great. Thank you so much. Good afternoon, commissioners. My name is Christina Gutta. I work for the Community Health Equity and Promotion Branch in the Population Health Division. I want to thank you and Mark for letting me come and share this work. So just a quick overview of the soda tax. I just like to always do a quick overview. It was passed in 2016. It began to be implemented in 2018. The tax imposes a 1 penny per fluid ounce tax on the distribution of sugary drinks in San Francisco. And the legislation also put into place an advisory committee of 16 members that makes annual budget recommendations to the mayor and board of supervisors. And they are also required to report on the public health impact and sales tax impact in San Francisco. So the next slide talks a little bit about the funding principles. And these are principles that the advisory committee developed. And they focus on low-income San Franciscans, populations that are shown to drink the most sugary drinks, and those then that are also disproportionately impacted by diet-sensitive chronic diseases like diabetes, obesity, and heart disease. And the support, the principles aim to support the tax goals, which were to reduce consumption of sugary drinks through a reduction of diet-sensitive chronic diseases, using tools like increasing water consumption, improving oral health, improving access to healthy food and physical activity, and other elements. I want to just talk a little bit about on the next slide, I'll show you a pyramid. It's I'm sure you've seen this before. It's the Centers for Disease Control and Prevention's Health Impact Pyramid, describing what are the factors that impact health. And at the top, you see those the kind of work that has the smallest impact down to the bottom, which has the largest impact. And the contracts that you approved about a year ago, I think, really sit in the middle towards the bottom of this pyramid, insofar that they are intended to have long-lasting protective interventions. They're changing the context in which people are surrounded or impacted by sugar drinks and the industry that promotes them, as well as addressing some, and to maybe a smaller degree, the socioeconomic factors. I think what is important to note here also is that these 5 contracts are really working on policy and systems changes. We have 11 other funded agencies through the Public Health Foundation contract that are working more on the top of the pyramid, providing programs, education, and different kinds of direct services. So let me get into what these contracts are about. The next slide talks about how we are defining a policy or systems change. And so when we talk about a policy change, it's essentially the development and enforcement of a written statement that helps an organization change its course that will also address health equity, health disparities, and the determinants of health. The systems change is a change in how an organization conducts business that will also address health impacts, social determinants of health, and so forth. And so when we put out the RFP for this, we talked about things like policies that decrease sugary drink marketing, or that impact how beverages are sold and offered by retailers, or changing linkages or creating linkages rather to bike sharing systems, making sure that low-income families can access the wonderful summer camp programs and after-school programs that our Rec and Park department has, or changes to the built environment. Those are the kinds of things that we're working toward. And we were also asking that it be community-driven and supported by the community members. So the next slide gives you an overview of kind of where we are. The contracts actually began in April of 2020, so there were really just a couple of months in that first fiscal year. And in that first and second years, we indicated support for them spending up to 75% of their time on COVID-related activities, because it was very important in that moment to support people that were being impacted by COVID. And most of that came in the form of access to healthy food. And we also asked that about 25% of their time be spent on what they were funded to do originally, which was policy and systems change, engaging the community. So years 2 and 3, and they are currently in their year 3, has really focused on engaging the community, collecting data from the community to understand what their interests are and what kind of policy or systems changes might be relevant. And we're hoping that there will be a year 4 in which they can continue the service delivery, as well as move forward on the policy and systems change that they're planning and the implementation. So what are the contracts? They were 3 years, and we do hope to extend them to 4. And we funded 5 organizations, and I'm going to go through each one of these organizations and give you a brief update on where they are. There are 18 Reasons, the Southeast Asian Development Center, Marin City Health and Wellness Center in the Bayview, and Central American Resource Center and Tenderloin Neighborhood Development Corp. I believe many of them are on the line. I don't know exactly, but some were having a hard time getting access into the meeting. But I think some of them are on the line if you have questions for them along the way. So let's just start with 18 Reasons. What you'll see on each of these slides is the program funding for the full term, and then a brief overview of the work, some outcomes, and their next steps. So for 18 Reasons, they've been working sort of on in 2 areas. Cooking Matters is their free cooking and nutrition class, and the Nourishing Pregnancy, which is really focusing on increasing food security, health, and well-being for Black and Latinx birthers, using culturally centered, further-centered approaches. And for 4 months, low-income participants get weekly home-delivered groceries and online cooking and nutrition classes. So to date, they've served 66 birthers, and graduates are reporting increased food security and cooking confidence. And they've reached over 1,000 low-income families through the Cooking Matters program, and 68% are reporting drinking fewer sugary drinks as a result of the program. So the next steps for 18 Reasons in terms of their policy and systems change is working on food as medicine services like the Nourishing Pregnancy into their prenatal and postnatal medical care. And there is work around medically supported nutrition, and they're supporting that work to be able to draw down federal funds through CalAIM. So that is where we are with 18 Reasons. The next organization, Southeast Asian Development Center, they're supporting youth-led initiatives to promote nutrition and wellness, as well as influence social determinants of health. To date, they have trained 18 health ambassadors in the first 2 fiscal years. They've surveyed over 100 community members about nutrition labels and identified that residents want to learn more about nutrition labeling. They have also advocated to the mayor's office for funding for nutrition labeling classes, and they've distributed free wellness kits to over 50 Tenderloin residents. Their next steps are to train the next cohort of youth ambassadors and collect and analyze data. Their systems change that they're working toward is working with local community-based organizations to adopt a no sugary drinks served here policy. The next organization is Marin City Health and Wellness Clinic in the Bayview. And their focus is patient-centered medical homes. And the goal here is to improve healthcare coordination and mitigate the impact of chronic diseases for San Francisco residents, with an emphasis on those that are disproportionately impacted by the consumption of sugary drinks. To date, they have done a really good job of integrating dental care into their medical activities. And through their dental clinic, establishing stronger connections to the rest of the clinic and connecting patients to diabetes care, recognizing how dental health can be an indicator of diabetes. They've been doing a lot of education of their patients and providing teeth cleaning, electric toothbrushes, water flossers, as well as and water bottles. And they're serving 30 patients in their case management and are adding another 20 this year. And they are working to improve the baseline health outcomes for their patients with hypertension and diabetes by 15%. So the next organization is CARECEN, Central American Resource Center. They've been working with promotoras or community health workers to connect Spanish-speaking community with resources that promote health and share resources, as well as gathering input to develop policies that promote healthy eating and active living that are in support of San Francisco's Spanish-speaking community members. They have carried a 60-person caseload for telehealth case management, and that continues. They have also conducted 200 plus surveys. They've held 3 focus groups and conducted 15 interviews with health equity leaders in service of identifying what kind of policy or systems changes would support their community. So their next steps are continuing that telehealth case management, as well as analyzing the data. And they haven't yet identified what that is. They're taking a very careful approach to ensure that community is on board with them, and that this is truly a community-led process to develop policy or systems changes. And the last contract is Tenderloin Neighborhood Development Corporation. There are 2 distinct programs embedded in this contract: the Tenderloin Neighborhood Development Center Healthy Retail Program and the Kaina program. And essentially, they're both working toward reshaping San Francisco's food retail landscape to understand barriers and address barriers to food access in the Tenderloin. The Healthy Retail Program has completed over 250 surveys about barriers to food access, and they've held numerous focus groups in many different languages to understand food access barriers in the TL, and they've done that with 65 participants. And Kaina, excuse me, they opened a free food market in the Mission Bay in one of the TNDC housing developments, and they've enrolled 180 households to come to their market. And it looks like a regular store, but it's all free for people to come in and choose what they want to take home with them. And that is in the Mission Bay, which has very limited access to healthy food, especially for low-income people. So the next steps, they are continuing to do focus groups in Spanish and Tagalog. They are going to be doing a community forum to review these focus group results and work with residents leaders to develop and lead a policy agenda. And so again, they also have not quite developed what their systems change is going to be, but they're carefully working in that approach with community support and involvement. So those were all the contracts. I wanted to give you a quick overview about more broadly and pulling the lens back a little bit on the overall impact of the soda tax. DPH analysis of the sales data shows to date a 7% decrease in sugary drink sales. When compared with another county, city that doesn't have a soda tax, Richmond, UCSF and Berkeley and Stanford researchers found that San Francisco purchasing of and consumption of sugary drinks has decreased by more than 20%. So we are seeing changes as a result of the soda tax. We're also seeing that there's been a decrease by 50% of purchases of sugary drinks at supermarkets in San Francisco. So there is change and there is impact as a result of the soda tax. I think I have just a couple more slides. So the programs, we are working with Ramey and Associates as our external evaluator, and they have been assessing not just the contracts funded by the Public Health Department, but also all agencies in San Francisco that are receiving funds from the sugary drinks tax. And what we're seeing clearly is a decrease in sugary drink consumption. That comes from data from our funded partners, as well as the sales data that have been analyzed. We're making good strides toward increase in fruit and vegetable consumption, physical activity, breastfeeding, as well as increase in food security and economic opportunity and stability. We don't have data yet on increase in tap water consumption. I think that has largely to do with COVID and the difficulty in and the fact that many fountains were shut down during COVID. So I think bottom line on the last slide, what we're asking or sharing with you today is that there is a decrease in purchasing and consumption of sugary drinks since 2018. The programs that have been supported with sugar drink funds are beginning to demonstrate success. We're reaching the most impacted communities. And I think lastly, that the contracts that we're here today, it takes time to show results when you're working toward policy systems change. You know that, you're policy people. And so the funded agencies are really a critical part of the outcomes because they are deeply engaging with community to develop long-term systems changes. So with that, I thank you for your time and welcome your questions and comments.
Commissioners, before I go to you, I'm going to check on the line to see, and thank you, Christina. Folks on the line, if you'd like to make comment on item 15, which Christina just presented, please press *3. Again, *3. All right, I see no hands, commissioners, from the public. Commissioner Guillermo, I see your hand.
Thank you. And thank you for the presentation. It's very interesting. I had a couple questions. One is on the slide with the soda tax impact. I was wondering, is there any ability to break down by neighborhood or by type of store or anything like that? Um, so that, this decrease, so that we just have a better understanding of what's happening within San Francisco and the boundaries, as opposed to just a general sense, because y- it's great to know, but it doesn't give us that much information about the targeting of the resources towards that, or the differential impact of the soda tax. And then there's a concern that I have also, because naturally the tax revenue is decreasing because of the decrease in consumption. And so how might these programs survive if there is that decrease, particularly if it's going to be at a critical time when the policy and the systems changes are going to really start to kick in. 3 years is not nearly sufficient time for, particularly given the kind of process that's being described in all of with these different organizations and the communities that they're targeting. I would imagine they're just going to be able to start getting some sense of the changes that need to be made and the way that they're going to be made, by the third year. Possibly, I mean, hopefully sooner, but as you said, we all know how long things take. So anyway, just a couple of questions, and then just one specific one. I'll just get them all in. The Marin City Health and Wellness Clinic, it doesn't show a strategy for systems change. So I'm assuming it's being built into their own services outcomes, but it would be helpful to know if that's explicitly the case or not.
Thank you, Commissioner Guillermo. I love your questions. They're all great questions that I have too at some level. So I'll try to go backwards and remember all your questions, but the Marin City Clinic is their systems change is moving toward a patient-centered medical home. So that was their systems change built in. And so they're working toward that and following the accreditation guidelines, but may not make it through the entire accreditation process in that 3 years, but this will have helped them move toward that. With respect to the fact that we are seeing declines in the soda tax, they haven't been the revenue drop has not been significant as yet. So for this round of grants and contracts, I'm not worried about the drop being so significant. And it is precisely because we expect a decrease in the revenue that we want organizations to be focusing on longer term systems and policy changes, so that communities are better equipped or aren't as surrounded by sugary drinks or whatever those policy systems changes might be, that sugary drinks just don't have as much of an impact on them. As the to date, and I don't have the exact figures in front of me, but the committee has been making recommendations for between 10 and 12, $14 million, I believe, over the last 5 years. That hasn't changed very much yet. So I think we're okay for now. But again, it is these long-term changes that we're looking for to mitigate the fact that the revenue will be decreasing. And we expect that it continues to decrease.
And the data breakdown?
Excuse me?
The data breakdown?
Yes, that's my favorite question because we want that information as well. Just briefly, the data that we are able to get, we have purchased sales data, but those data are limited to larger stores. It doesn't capture the small stores. So one thing we're looking at is, trying to figure out how to get data from the smaller stores. And we are in communication with the Treasury and Tax Collector's Office to see if they can share with us how much revenue is coming in from all the different kinds of places in San Francisco. The challenge is that it's a distributor's tax. So it's the distributor that has to pay the tax. So if it's a Coke truck pulling up in front of a corner store, that means that it's that company that is paying that distributor tax. So we may not get the breakdown that we're looking for. If the store owner goes to the Costco outside of San Francisco, like in South City or something, they are responsible for paying that fee. So the data are murky, and we are continuing to look for avenues to get exactly that kind of data that you asked about. The data we purchased from IRI, and I cannot remember the acronym right now. Sorry, but we purchased that. It is limited in terms of how we can use the data. They do not allow us to try to identify the stores. So we're hoping that through the Treasury and Tax Collector's Office, we might be able to get a little bit more neighborhood level data. We're working on it. And I think the other element of challenge is that the epidemiologist that is funded through Soda Tax has been deployed to COVID for the entire time. Well, since the top of 2020. So we're just there's a lot of data we're interested in. So we're still working on it, and hope to be able to better dissect and understand where sugary drink sales are happening.
Thank you.
Commissioner Chow.
Yes, I had to find the button. Sorry. I found this very interesting, and thank you very much for the follow-up and for not only showing us that the tax has had an effect on the public, but that there are some these specific programs that you're using that were recommended by the Tax Advisory Committee. So I think the idea that you have of trying to not just look at service, but trying to develop for these communities policies and how that could be carried on is really very impactful for them in the long run. And obviously in the short run, and with COVID having intervened, the ability to have used the taxes in order to help people who really need it, nutrition help and so forth, and get them to avoid again empty calories was very very good. I just had a concern with the two OB programs in the Bayview Clinic and the Central American Resource Center as to what the consultant said as a beginning to work with people. It would seem that that was a good idea, and it gets people centralized. And as you said, thank you for explaining that the Bayview Clinic is really heading and using this type of funding to get to a PCMH program. So that will be in the long run very helpful. In the short run, I'm wondering if there was any analysis on the part of the evaluation in the cost effectiveness of the very small numbers, really, of obstetrical cases that were handled by both of these organizations. I think it's a startup, and to use that as a focus is useful. But if you continue at that level, then it's costing like $1,000 a person per month to try to carry on OB services. And I'm pretty sure that's not really kind of where we're going with these, especially if we're looking for them to look at what is the long range. If they're going to be providing OB services as their forte, then these costs will have to come down, especially if we're going to, it seems to me, be able to sustain a program if that's the desire of the community.
Thank you, Commissioner Chow. The evaluators have not looked at cost effectiveness yet. I think it's just that there's such a breadth of work that is being analyzed. And, we will take under consideration the comments and concerns that you raise around the high cost of some of these services. Recognizing that I think in some cases, these services are a way to bring community in to engage them. And it does not mitigate the fact that some of these services are, maybe costly. I think for the birthing program, that program is also supporting the Cooking Matters Nutrition Education program. So it is split between two programs.
Okay, no, I think it's just something, and I appreciate that. I'm sure that you're all going to be looking to make best use of the resources, and it can be done lower cost probably, and be able, just like you said, I didn't really recognize that the cost was really split into another program, but that's where you're right. I mean, to bring about community involvement, to get people to have trust in the organizations, in being a valued partner in their healthcare. All of that is useful, and the fact that you're really looking for long-term policies, not just simply services that would be funded by the advisory committee's direction. So I think that's really great direction, and would look forward to hearing how well in your next iteration and evaluation you've been able to come, because you're just getting to that point, right? Of being able to look at broader policies for those key communities. So thank you.
Great, thank you so much. I believe there are no more comments or questions from the commissioner, so we can move on. Item 16 is emerging issues, commissioners. Commissioners, with the information that I sent you yesterday about one of the agencies, I want to loop back and want to ask you again, how would you all like to hear information on large organizations that contract with the DPH? I know you've asked over different iterations, over different meetings. We're at a new crossroads, I believe, and I want to be able to take a clear message to the administration about what you all might like to see, to make sure that you're able to monitor and that you have your finger on the pulse of what's happening with the contracts that you're approving over time.
Well, that that was part of. Unfortunately, you didn't see the document I sent to you, which was to ask that on these large major organizations, we be sure that there is a stability, especially with the issue that was raised recently. I think it was with Baker Place, that then had us approving contracts, and I think the Board of Supervisors got a little upset at this too, and yet not realizing that things were not as good as they should be. But uh, in last meetings in July, we were told that we were going to get follow-ups on what the situation was in terms of those. So I think that it isn't that we could give you, I think, a specific way of doing it. I think we're asking administration, what is the way to answer your question, and then present to us so that we have knowledge to be able to discharge our duties in a responsible fashion with all the data that is there. And I don't know what it is, but clearly when they said they were coming back in July to let us know what was happening, if that was needed, uh, didn't sound like it was needed, because we have gotten no follow-up. So I do think we need a process. In the older days, shouldn't say older days, but in previous times when we did have some really significant issues, of the challenge of Baker Place, commissioners and the finance committee members were actually brought into discussion to be able to use as a sounding board and input as to how to handle this, and what is the best way to work with the community, and which and understand what the department was thinking of doing, and dialogued about that. So that's another iteration beyond just simply presenting facts, but to make use of perhaps the expertise of the commissioners to be able to help work through the problems with the CBOs that may be having difficulties. So I do think that's a question that we as a commission, and perhaps Commissioner Chung as the finance chair, should really be communicating and getting an answer from the administration, not for us to really specify, a process. But that's my opinion.
Thank you, Commissioner Chow. Commissioner Guillermo, you have your hand up.
Yeah, first, I just want to agree with Commissioner Chow in his response to your request, Mark. And then secondly, just sort of going back to what the agenda items that we had to manage earlier in the meeting, this issue of the timing and how, and I know it doesn't happen every meeting. It's obviously something that has to do with when contracts are are executed or being executed or developed, the budget process, and then the timing for getting things to the mayor and the board of supervisors in time for no lapse in services and such. But I do feel like there's something that if we can get even just a calendar or schedule of things that are coming to us from a contract standpoint, that would help, I think, just have, at least for myself, understand where there might be some bottlenecks or where we might be able to help the staff be more, and ourselves as committee members, to be more in sync, going forward, because it's a little bit frustrating. I'll have to, I have to say, to know that there are these deadlines that sort of creep up on us, and we're trying to rush things through without full understanding of what the timing and the process is relative to our responsibility and our authority.
Thank you so much, Commissioner. I've noted that and we'll pass that on. Commissioner Chung, any comments from you?
Yeah, I think that, like this been ongoing since I came on board 12 years ago. I think that this discussion, that sometimes it's really difficult for us to know how big some of these like agencies are, because the contracts adds up, but we don't really have, like we're not there tracking how many contracts they actually have with DPH. Like it's DPH to tell us, like for transparency reason. But rather than having us keep asking for that, if there is a way for staff to tell us, like how many contracts, like a certain agency has, it will help us get some ideas, because this, we are in the business of providing services. We're not in the business of like hostile takeover or like mergers or like or acquisition. So I think that it's really important for us to remember why we're doing what we do, and to really make sure that we're intentional when we're investing in the community. I think the case in point is, like most of the services for Black communities do not survive the way that some other businesses do here in the city, and so we need thoughtfulness, we need more intention, so that like we can really look at like equity more than just from a health standpoint, but also an economic standpoint.
Thank you, Commissioner. This will be an ongoing, thing, but I will certainly take this as I think we're at a crossroads, so I'll take this back and we'll try to get more clarity, and we'll try some things out, and hopefully there'll be some improvements to better meet your needs so that you're able to do your work. So that's what I'm concerned about, supporting you, knowing that you need to do your monitoring, your guidance. But thank you very much. Is it okay to move on? Any other comments, questions? Okay. Item 17 is public comment. Anyone on the line, if you'd like to make a comment about something that's not been on the agenda today, this is the time to do it. And you can press *3 so we can recognize you to make that comment. *3. All right, I don't see any hands, Commissioner. So you're now at a consideration for adjournment.
Hi. Hi, sorry, this is Monique Lasara. I was on for listening earlier, but I wanted to make a public comment. Is that possible? Or no?
No,
That's okay if I can't.
You're inside the meeting, so the people in the meeting generally don't make public comment. It's usually people who are outside of the meeting do that.
Okay. I'll call back and do that.
All right.
Thank you.
I apologize for that confusion. Commissioners, consideration for adjournment.
So move for adjournment.
I'll second.
I'll do a roll call vote. Commissioner Chow,
Yes.
Commissioner Chung,
Yes.
and Commissioner Guillermo.
Yes.
Ms. Lasar, I didn't mean to cut you off. If you'd like to email me a comment, I'll pass it on to the commissioners. It's kind of a weird, convoluted.
No worries. Thank you so much.
Okay.
Appreciate you all.
All right. Thank you. Take care, everyone.